So I like to say that with Ask Ellen, we built the tool that I longed for when I was first diagnosed. Breast cancer and a breast cancer diagnosis is a very isolating and scary and lonely journey. And it's particularly so in those early days when you've been told you have cancer, but your treatments hasn't started. And then after treatment ends, when the trauma really hits in and you start to realize what you've been through. And so Ask Ellen is there not only in the care journey to support your clinical care team, but she's there during treatment and in between appointments, but she's also there in those very earliest days when you're scared and alone and afraid, and after treatment ends, when you're trying to reconcile survivorship and what life looks like now that treatments have ended and you're moving forward with your life.
As a former oncology nurse, I have always seen how heartbreaking a breast cancer diagnosis can be for patients and their families. And that's not only the diagnosis, but the entire process, even to post-treatment issues. And what most of those patients, they usually report in common is that they do not have enough peer support and they don't know where to find answer for the questions. So in that sense, using AI as a peer support tool to try to complement the comprehensive care provided by healthcare professionals can help us to provide the best care for those patients and try to improve their overall quality of life. So what we're aiming to try in that research is to collect evidence on the efficiency of such tools, so we can have empirical evidence to be published and make available for other types of cancers as well. So we can try to set the pace for other researchers to do similar ideas. So for example, for lung cancer or even for healthcare professionals. So that can be one of the many other studies that are to come.
So the benefit of using an AI companion in conjunction with traditional support mechanisms and the clinical care journey is that AI doesn't sleep. It doesn't take a vacation. It shows no judgment. And it speaks to you in any language. And that's really the benefit that we've discovered with Ask Ellen, is that it fills in all those cracks and valleys in between those appointments when you're on a journey for breast cancer